Welcome to this webinar on trace and data editing in jitter analysis. Single fiber EMG is the most sensitive method to study disorders of neuromuscular transmission. It has a sensitivity of 95% when two muscles are tested. A normal single fiber EMG examination in a weak muscle excludes the diagnosis of a neuromuscular junction disease. So the jitter analysis is useful to confirm the presence of a neuromuscular junction disease, but it is also useful to exclude it. Jitter analysis is indeed a very powerful method for use in a electrodiagnostic laboratory. For jitter analysis, we often use the so-called single fiber needle. This needle has a very small recording surface, only 25 micron in diameter. And this allows us to truly record a single muscle fiber action potential. However, this electrode is reusable. It is expensive. It is difficult to maintain. And in many countries, it is not allowed to use the needle again. And therefore, we must use disposable electrodes. As a result, it has been recommended that we can use concentric needles for jitter analysis, but with a few qualifications. We must use the so-called facial or pediatric needle. It has a smaller recording surface, only 0.02 to 0.03 square millimeter. The standard concentric needle has a recording surface of 0.07 square millimeter. And we want to emphasize that when concentric needle is used, we are measuring jitter between spikes. They may or may not be true single muscle fiber action potentials. To record the signals, if we are going to use the single fiber electrode, our bandpass filter is 500 Hz to 10 kHz. For concentric needle, we increase its selectivity by raising the low frequency setting to 1000 Hz. The high frequency setting stays at 10 kHz. The sweep is set at 0.5 to 2 milliseconds per division. That corresponds to a sweep duration of 5 to 20 milliseconds. We usually start the examination using a display gain setting of 200 microvolts per division. It can be adjusted as necessary. And we used the amplitude trigger and delay line to display the signals. Upon inserting the needle, we ask the patient to give slight force of contraction. The needle position is adjusted to record two or more time-locked potentials or spikes. Keep in mind that jitter analysis requires two potentials or spikes. A single spike, though looking very nice in amplitude and duration, is of no use for jitter analysis. The potentials should have a sharp rising edge. That gives it a very crisp sound on the audio monitor. We can also assess the sharpness of the rising edge through the so-called quality meter that is often used in EMG programs. And secondly, the rising edge should remain similar during recordings. In other words, the rise time of the potential shouldn't change from one discharge to next. We like to record 100 or more sweeps. My preference is about 150 sweeps. That gives me sufficient number of action potentials for jitter analysis after excluding noise, interference, and artifacts. With a motor unit discharging at roughly 10 Hz, it usually takes 10 to 15 seconds to record the necessary number of sweeps. Let us look at a single fiber EMG recording. This is a jitter recording made using a single fiber needle electrode. Note the low frequency setting of 500 Hz, the high frequency setting of 10 kHz. The gain is 1 millivolt per division. The sweep is 500 microseconds or 0.5 milliseconds per division. So the total sweep duration is 5 milliseconds. We are recording from a pair of action potentials that are time locked. This is the first action potential. This is the second action potential. We are triggering on the first action potential, so it appears at the same location. The second action potential occurs at slightly different places. The difference in time intervals between these two action potentials is the jitter. Let us look at these signals as they were recorded. Upon recording the signals, we measure the so-called interpotential interval. Once again, here are two action potentials that are time locked. We are triggering on the first action potential. Therefore, it looks very sharp. It appears at the same position. This is the second action potential, which is jittering, and its position changes on the screen on successive discharges. The time interval between these two action potentials, AP1 and AP2, is the interpotential interval. Jitter is a measure of this variability in the interpotential interval. To measure the interpotential interval, we place so-called windows on the traces. Here is the first window, which is often called start window, and it's placed on the first potential. Then we place the so-called stop window on the second potential. When the action potential crosses, or when the signal crosses the first window, we start measuring time. When the signal crosses the second window, we stop measuring the time. And the time measurement is the interpotential interval. Notice that the signal is crossing the window many times over here in the stop window. We only look at the first crossing over here. This is called the level-based interpotential interval measurements. We can also use the peak of the action potential for measurement of interpotential interval. Any approach is quite acceptable. Having measured the interpotential intervals, the computer will then calculate the so-called mean consecutive difference. I will illustrate the calculation using these 5 sweeps. We have already measured the interpotential intervals indicated in this yellow box. Let me tabulate them. 1682, 1678, and so forth. Let's look at the first 2 intervals, 1682 and 1678. Their difference is 4. And I'm going to note it down in the next column, which is called the delta IPI, or the difference in the interpotential intervals. Let's take the next pair of interpotential intervals, 1678 and 1781, and the difference is 103. If we get a negative difference, we ignore the sign. So we repeat this process and calculate the difference in interpotential intervals. We add all of these, so the total in this case is 142. And then we divide this by the number of interpotential interval differences. We have 4 numbers over here, and by dividing we get the mean value. This is called the MCD. So to reiterate the process, tabulate the interpotential intervals, calculate the difference between successive intervals, ignore the sign, and then calculate the mean value. That is MCD. That is what the system does for us automatically. There is another way of calculating jitter, which is called the mean sorted difference. And this requires identification of the so-called inter-discharge interval, or the firing rate. These values are also listed in this yellow box. We begin by creating this IPI delta IPI table by sorting the data on the inter-discharge interval. So in this case, the shortest inter-discharge interval is 140 microseconds. So I place it in the first row. The next shortest interval is 162. That goes into the next row. The next shortest interval is 190. That becomes the third, and then so on. Now that we have sorted all of these intervals based on the firing rate, we use the sorted interpotential intervals to calculate the consecutive difference and calculate the mean value. So this is the mean sorted difference. MCD and MST are 2 different ways of measuring the variability in interpotential interval. And jitter is the smaller of these 2 values. So we measure both results, and whichever one is smaller, that's the value we call jitter and use for analysis. Now, in a typical jitter study, we measure jitter from 20 action potential pairs. Now, for each pair, we require 100 discharges. That means for a typical study, we need to look at 2,000 traces. Noise and artifacts are inevitable, and therefore it is necessary to review these traces and data. And the old-fashioned approach, which is a good approach, which was very successful, is to look at the traces individually. And if we have to go through 2,000 traces, that's going to be very tedious, and that's going to be very time-consuming. And this has been one of the frustrating parts of performing jitter analysis in a busy clinical EMG laboratory. To simplify jitter calculation, to make it easy to reduce the time, we now use the so-called graphical data editing approach. We don't look at the traces at the first resort. We look at the graphical presentation of data to identify bad recordings. And that's the theme of this seminar. So we edit the data based on interpotential interval distribution. So what do we mean by interpotential interval distribution? As I indicated earlier, we record 100 or more sweeps. From each sweep, we get 1 interpotential interval value, and we plot them in a successive manner. So in this plot, along the x-axis, we have the interpotential interval number, or the sweep number, and on the y-axis, we have the interpotential interval values. So this is the pattern of change in the interpotential interval values during our recording. And this distribution is extremely useful to assess the quality of the data and also some of the other information about jitter. For example, we can see the interpotential intervalues are a little bit low over here and they're a little bit high over here. So perhaps there is a trend in this recording. You can readily appreciate the power of this plot. Just to demonstrate the concordance between the waveforms and this plot, let's look at some jitter analysis. Here is a recording. This is the triggering potential. Here is the jittering potential. We have a very good superimposition indicating very low jitter. Here is the sequential interpotential interval plot. And notice that it is showing us a very thin line. There is hardly any variability. And this is consistent with a low normal jitter of 10 microseconds. So good superimposition over here, very little scatter over here, and low jitter value. Let's look at another example. This is the triggering potential. It is time locked over here. This is the jittering potential. We can see more variability on the traces. This is manifested as more scatter of data points in the sequential interpotential points, and the jitter in this case is 40 microseconds. So there is a good correspondence between the visual assessment of the waveforms and the scatter of the interpotential intervals in this plot. So with graphical data editing, we are essentially looking at editing. We are going to edit the distribution of interpotential intervals. So the first step in our editing is to exclude any extreme values. The next step is to exclude triggered sweeps from other motor units. Ideally, we like to have discharges of a single motor unit, but we will get activity from other motor units, and that will interfere with our measurements of interpotential intervals. And then we want to exclude the trend. All of these things can be done by looking at the interpotential interval plot. The next step is to exclude traces with interference from other motor units. We may have a superimposition of two different motor units that affects the interpotential intervals. And finally, we like to look at blocking. This is an important phenomenon, and this is something that the operator must decide. So let us see how all of this is accomplished using the graphical data editing tools. Now, before we get into the details, I just want to emphasize some important points about trace editing. It is a good practice to record good quality signals to keep editing to minimum. If our signal quality is not good, we will spend a lot of time on editing them. So no matter how good tools you have, we are still going to spend extra time, and we are not very confident because of an extensive editing about the quality of results. So always record good quality of data. The trace editing tools are merely to help you clean up the data and remove some of the few mistakes. Keep in mind that you need at least 50 traces to demonstrate normal jitter. So you should record 100 or more sweeps. And as I indicated, avoid excessive editing. So the first trace, or rather the first step in our graphical analysis is to select the traces using the start and stop windows. The position, the amplitude position of the window should be on the steepest portion of the rising edge. We often trigger the signals near the peak to exclude activity from other motor units, but when we position the windows, they should be on the sharpest portion, and this is usually halfway between the positive and negative peaks. Secondly, the width of the window should include all discharges of the motor unit. Keep in mind, only the first crossing in the window is used for analysis. So here is an example. Here is my start window. Notice that it is on the sharp rising edge over here, roughly between the peak and the baseline. And here is my window on the second potential. It is wide enough to include all discharges of the second potential. So if we made mistakes in positioning these windows, we may not have correct jitter. So it is important to place these windows properly. And it doesn't take much time. We can just click with the mouse and drag it to the correct position. The program also places the windows automatically, which are often satisfactory. But if they are not, it is the responsibility of the user to change the position and width of these windows. The next step is to exclude extreme values. Now, MCD and MSD are statistical measures of the IPI variability. And in statistics, it is customary to exclude extreme data points. For example, if we have a Gaussian or normal distribution, we often use a 3 standard deviation band about the mean for analysis. And this contains about 99% of measurements. So here is a recording. We have a nice action potential pair. We have placed the windows, and here is the distribution of interpotential intervals. The green rectangle that you see on top of it represents a 3 standard deviation about mean. All the interpotential interval values that are inside this box are used to calculate jitter. We have one outlier value shown by the blue data point. Notice that it is below the box. This is a very short interval. And if you look at the traces, it also corresponds to the blue trace over here. Once again, I'm trying to demonstrate the concordance between the assessment of traces versus the assessment of the interpotential interval plot. It is much easier to look and manipulate this plot rather than the traces. And I will describe this a little bit later. So here is my one outlier. These are about 120 discharges. As I indicated earlier, using the rules of statistics, 3 standard deviation band contain 99% of the data. So if you had 100 sweeps, we will expect to see one outlier. And this fits the model of statistics very nicely. And this actually gives me more confidence in my analysis, that my data indeed has a good Gaussian distribution in this recording. What effect does the outlier have? In this case, when I excluded this outlier, my jitter was 13 microseconds. When I included this, the jitter became 14 microseconds. It didn't change much. Let's look at another recording. Here we have the superimposed sweeps, good quality recordings. Here is the distribution of interpotential intervals. And here is the 3 standard deviation box. And notice that we have 2 outliers. These were thrown, these data and traces were thrown out automatically by the program. Now, is it justified? Let's look at the traces. And here are the 2 traces with short interpotential interval. They did come quite a bit early, and you can also see a kind of plateau or a shoulder on the potential. This is not a good quality potential for analysis. So indeed, exclusion of those outliers actually is justified when we look at the waveforms. So that's why I do like the use of the 3 standard deviation box to exclude the outliers. Now let's say, for the sake of argument, that I wanted to include those traces, and that is done quite easily by dragging the edge of this box and moving it up and down. This is a static image, so I cannot show that. I will show that later in a video. So now that I have included these two extra data points, my jitter is 23 microseconds. It increased from 17. Now, does that make much of a difference? Probably not. 23 is still a very normal value of jitter. But if you think about it this way, these two data points increased the jitter from 17 to 23. It was an increase by 33%. So these two data points had a lot of effect on our jitter values. And therefore, it is important to exclude these solitary or outlier values. In past, we would have gone to these particular traces and we would not be sure whether to exclude or include them. Reaching them would have taken a lot of time. But when we look at the distribution of interpotential intervals, it is very easy to recognize them and very easy to exclude them. So this is one of the graphical tools that we use in jitter analysis. We can also remove the trends. This is a distribution that I showed you earlier. We have low interpotential interval values at the beginning, high values at the end. And the jitter over here is 44 microseconds. Let's say I want to get rid of the data points in the beginning. This is where I do not see the trend. So in the software, I can click on the left edge of this box and I can drag it to right, and as I have done it over here. Now I am analyzing only those values that are inside the box. There is no trend over here, and the jitter is 42 microseconds. It really didn't make much of a difference. And this is inherent in the formula of MCD. The data that were excluded are shown with blue color. So this is another powerful tool for removing trends. Now sometimes we will get interference from other motor units. We like to trigger on a single motor unit, but if there is another motor unit which produces signals that also trigger the sweep, perhaps they have similar or higher amplitude, we will get discharges of those motor units in analysis also. And those discharges can have a single or multiple time lock spikes. So we will analyze both of these situations independently. So here is the first instance. I am interested in measuring the jitter from this action potential pair. But in the background, I have a higher amplitude potential, which also triggers the sweep. Notice that here we have a single action potential. This is of no use for measuring jitter. There is no time-locked action potential over here. But it does appear like blocking. Here we have an action potential pair, and on some sweeps we have a single potential. This is what we call a technical block. If we look at the distribution of interpotential intervals, we have a nice tight distribution. This is what we see with normal jitter. And at the top, we have the red points over here. This is where we were not able to record any interpotential interval, either because there was only one action potential or we failed to see any action potential. So if there is no interpotential interval, is it a block? And if it's a block, is it a real block or it's a technical block? So what the program does, it measures the jitter, and in this case it was 15 microseconds, and we know that we cannot have blocking when the jitter is normal. So these blocks must be the technical blocks, and these traces are excluded automatically by the program. So when we look at our instrument screen, on the top we can see the traces that we recorded. We can see the windows that were placed automatically. And in the bottom window, we see the traces that were analyzed. They are shown in white color. The traces that were excluded are shown in blue color. If we look at the result table, there is no blocking. So not only we use graphical editing tools, but we also use different color combinations for traces, so we can immediately see which traces were included in analysis and which traces were excluded in analysis. In the software, we reject the block when the jitter is less than 60 microseconds. So this is the way we can handle traces from other motor units when they have a single action potential. Now, if we have discharges from two motor units and both of them have an action potential pair, we get the so-called bimodal pattern. So here is the signal. Here is the triggering potential, which is remarkably similar for the two motor units. Here are discharges from motor unit 1 shown in blue color and discharges from motor unit 2 in white color. This is our start window. This is our stop window. And when we look at the interpotential interval distribution, we get the bimodal pattern. This is the first mode, and this is the second mode. So whenever you see data points with two lines or two clusters, that indicates that we have discharges from two different motor units. And we can now exclude the traces from the interfering motor unit in two ways. One method is to adjust the position of this window so that we can select discharges from only motor unit 2 or motor unit number 1. The other alternate, as shown over here, is we can adjust the limits of this window, the right edge, the left edge, the top or the bottom, to select discharges or the IPI values from a single motor unit. So this is another powerful way of excluding traces from interfering motor units, and this is particularly useful when you have a bimodal pattern. Notice that it is very easy to change the limits of this window rather than going to individual traces and exclude them from analysis. So once again, here is the cluster representing discharges of motor unit 1 and a cluster from motor unit number 2. Now sometimes we will have interference from other motor units, and those traces may affect IPI. So the first question that I asked myself about excluding interference from other motor units is, does it affect the interpotential interval? So here is a recording. Here is our triggering action potential. It is time locked on the screen. Here is our jittering potential, and we can see discharges from other signals on the screen. Now here is where we are interested in measurements. Here are the signals that may interfere with my interpotential interval analysis. We should exclude these traces. And we do this in the software by using the so-called magic rectangle. I will show that in a video later. But essentially, using a mouse, we draw a rectangle on the screen, and any trace that intersects this rectangle is excluded. So I would draw a rectangle over here to get rid of this, and perhaps something over here. Once again, this is a very fast tool of excluding traces rather than looking at traces individually and excluding them. When I exclude these traces, I'm left with this. Notice that there is no interference with the rising edge of this potential or the rising edge of this potential. I'm happy with this editing. What about these traces? They are interfering in our recording, but they are not interfering with our measurement of the interpotential interval. So although they are interfering and they don't look nice on the display, I do not remove them. I think removing these traces is considered as excessive editing. We know we don't live in a perfect world. We cannot have recordings without interference from other motor units. We accept it so long as they don't interfere with our jitter analysis. And in this case, the jitter was not significantly changed when I removed the interference from the other motor units. when we look at the sequential interpotential interval plot, the blue squares indicate the values that were removed. And since they are scattered all over here, the jitter did not change upon removing the interference. Blocking is an important phenomena in single fiber EMG examination. And it is up to the operator to check if it's a real block or it's a technical block. And this is where we must focus our attention on the triggering action potential. The block traces are shown in red color. Once again, I emphasize the importance of color coding in our trace editing tools. White traces are used for analysis and used for measuring the jitter. The blue traces are excluded from analysis. Perhaps in this case, this interval was too long, outside the 3 standard deviation band, and the red trace is for blocking. When we look at the triggering potential, it shows a good superimposition. So this gives me confidence that the blocking seen over here is not a technical block. Once again, to reiterate, this is how a technical block looks like. This is our triggering action potential pair. This is discharge from a second motor unit. It doesn't have a time lock potential. So if the system reported me blocking in this case, that would be quite incorrect because the shape, including all the traces of the first potential, is not the same. Also, when you look at the jitter, it is increased, often greater than 100 microseconds when we have blocking. Note the scatter of the interpotential interval values. The user must confirm the blocking, and sometimes if the jitter is mildly increased, say greater than 60 microseconds, the system will not discard any blocks. We have presented in the software a button called block. By using this, we can override the blocking found in the signal. So in this case, I made the override and removed all the block traces in this signal. There is no red trace. It's a mistake in this recording to exclude blocks. I just wanted to illustrate the software feature. So always remember to confirm the block, and if the blocking is not correct, use the block function key to override the automated analysis. So now let's use these principles to analyze some of the single fiber EMG recordings. Here is the first signal. This recording contains discharges from 2 different motor units. Here is the triggering action potential, which is quite similar for both motor units. For one motor unit, here is the jittering potential. This is what we will observe initially in the signal. And towards the end of the recording, we will see discharges of the second motor unit where the interpotential interval is shorter. Let's look at the signals. Motor unit number 1. And now motor unit number 2. Here are the superimposed discharges. Here is my start window. This is the stop window. Notice that it is crossing discharges of both motor units. Here is the resulting distribution of interpotential intervals. Notice the bimodal pattern. Initially, we have longer interval values from the first motor unit, and towards the end, we have shorter interval values from the second motor unit. We can adjust the limits of these windows to exclude data from the interfering motor unit. So if I want to analyze the data from this distribution, I will raise the lower limit. And let's look at the result. We have selected discharges from the motor unit that was discharging initially over here. If I change the limits, let me restore them. Bring the top limit down. It's not necessary, but you can also change the limit on the left. And now I'm analyzing jitter from the shorter interpotential interval motor unit. So in this way, we can adjust the limits of this box on the interpotential interval plot and select the appropriate motor unit activity for analysis. So that was an example of how we can look at the outliers using this box, an example of bimodal distribution, and how we can extract the activity of a single motor unit. Now let's look at another recording. It is a little bit more complex. This recording contains discharges from several different motor units. I am interested in analysis of jitter from this action potential pair seen on the white traces. We can also see background EMG activity of higher amplitude that came from other motor units, as seen on the blue trace. Notice that these signals contain only one action potential. There is no second time-locked action potential on these traces. This mimics blocking. Because these potentials are generated by a different motor unit, we call these technical blocks. Let us see how the software can handle technical blocks in this recording. Let us look at the signal first. Here is the action potential pair that I am interested in. You can also see the triggers from the higher amplitude potentials. Let us look at all the signals. Here is my start window, here is my stop window. These were the automatic positions selected by the program. The start window is usually left at the trigger location. While this voltage level may be good for triggering, it's not optimal for measuring the interpotential interval. I'm going to bring it on the sharpest portion of the rising edge. So I will click on it, drag it over here. It's roughly halfway between the peaks. And the position of my stop window appears satisfactory. I'm not going to bother to change it. We have traces in different color. The traces in white are the action potential pair. They were used for jitter analysis. The traces in blue were excluded automatically by the program. Notice these are the interfering action potentials that do not have any time-locked second action potential. So these were the technical blocks, and they were rejected by the software automatically. And the reason is that the jitter is normal, 28 microseconds. We cannot have blocking when the jitter is normal. So this is a powerful rule to exclude mistriggers or the technical blockings. Let us look at the traces that were accepted for analysis by the program. We can see the action potential pair, but we can also see interference from the background EMG signals. We can exclude them by using the so-called magic rectangle. I'm going to click with the left mouse, hold it down, and then drag it to make a rectangle. Anything that crosses the rectangle, those traces will be excluded. So this is indeed a very powerful and easy way to exclude interference from the background signals. You don't have to go trace by trace identify them. Now we are left with some interference in this portion of the screen. This is the activity from the other motor units, but it is not interfering with my interpotential interval analysis. And therefore I'm not concerned with them. I'm not going to remove these traces. It is unnecessary. The jitter is now 26 microseconds. Notice that despite activity from several different motor units and missed triggers, we were able to get an accurate measurement of jitter by using just a few clicks of the mouse. So to summarize, the graphical data editing tool is a visual presentation of jitter. It is very easy to recognize normal and abnormal jitter from the scatter of the IPI values. It is very easy to recognize trends. It is very easy to recognize and analyze jitter from multiple motor unit or action potential pairs. And we saw this in the recording towards in the first recording that I analyzed for you. We can detect and delete outliers quite easily by manipulating the limits of the square window or the 3 standard deviation band window. And we can remove the interference from other motor units by using the magic rectangle. Finally, we have a rule for detecting the technical block. Notice that all of these graphical tools are very easy to use. You just have to click and drag some box limits, or change the position of the windows, or draw rectangles to the magic rectangle to get rid of interference. You don't have to access individual traces, and that's what saves time. So the approach is very intuitive. It is fast, and it is so fast that we can actually do the jitter analysis in an online manner. We don't have to save all the data, come back later, and spend another 45 minutes analyzing it. No, it takes only a few seconds to make sure that the quality of analysis is good, so we can do analysis as we are doing the recording. If you wanted to do it in offline manner, it is certainly possible. That option is still available. As we looked at this analysis, I never went into the display of individual traces. It is not necessary because the visual assessment of traces is reflected in the distribution of interpotential intervals. But if you feel comfortable, or if you want to look at individual traces, you can certainly do this. Since I have started using the graphical data editing techniques, I rarely find it necessary to look at individual traces. And in this way, the jitter analysis will become faster. You will have good quality jitter values. It will save you time. And thus, jitter analysis will become a powerful technique of electrodiagnostic studies in your EMG laboratory. The graphical data editing tools are indeed a significant enhancement and improvement in jitter analysis.